friends. I am Dr. Abhishek Ray. I'm currently working as a spine surgeon in the Mission Hospital, Durgapur. I've completed my graduation from Immon, Pondicherry, followed by my post-graduation in Mumbai. Following this, I had spent about 4 years in training in spine surgery in the US. And at present, after coming back to the country, I have been working in Durgapur as a spine surgeon. So the commonest presentation of a spine-related problem about a patient is pain, mostly at the back or the neck. Though that is the most common thing that they present with, the other things that they may be complaining of when they come to the clinic is leg pain or numbness or tingling sensation, electric-like sensation, or inability to walk, difficulty in walking or standing up upright for long distances. So in patients, back pain is the commonest source of disability in any patient less than 45 years. Back pain or symptoms related to spine is almost the second most common problem with which a patient sees a doctor. Spine-related problems also remains the fourth common cause because of which a patient actually seeks hospitalization. So keeping these in mind, you can very well make out that spine-related problems are very, very common. So back pain is not caused by only a single problem. As in many cases, there are many different factors which actually can go on to cause spine-related problems. Factors like the build, the body habitus of a patient, the profession that he's involved in, the type of activity that he's involved in, everything, all his habits, the sleeping posture, his sitting posture, all these go on to manifest the symptoms that the patient have. Obviously, there is a role of family history. However, let me reassure you that a family history of back pain does not mean that you will be having back pain in future. So basically about 95% of spine-related problems can be taken care of by medications, or at the most medications together with exercises. It is only in about 2% of the patients that we see in the clinic who finally eventually require surgery or are advised surgery. So you see a vast majority of the problem are either by itself self-limiting or get better with just a few medications or exercises. However, there are a few conditions in which surgery is advised, keeping in mind the future well-being of the patient. This is a question that has been asked over a wide section of the society. So let me tell you, spine surgery is quite safe. It is just like any other surgery, like appendix surgery or a gallbladder surgery. In fact, over the last 5 to 7 years, there have been tremendous development in this field, especially in trying to make spine surgery more and more safe. So as of today, it is as safe as any surgeries can be. Let me say that. That is another place that there is a confusion in the general public regarding whom to approach if you have any spine-related problems, whether you should go to an orthopedic surgeon or you should visit a neurosurgeon. So let me tell you, basically an orthopedic surgeon or a neurosurgeon have training to deal with spine-related problems right from their training days. However, it all depends on who decides to further specialize in this subject. So I would say a safe bet is to go to a spine surgeon, whether an orthopedic or a neurosurgeon. So basically he'll be an orthopedic or a neurosurgeon who has worked and has considerable experience in this particular field. So there have been quite a few patients, and I'm sure like any person who has undergone surgery in spine, I hope they are doing well and are happy with the procedure. But it brings to our mind a young girl who had come in from South Bengal with a horrible deformity of the spine, and thankfully after a very major surgery we were able to get her back to life, back to normal life. And right now it's been about 5 years after, I would say about 4 years after her surgery, and she's pursuing a normal course of education and on her way to be very successful in her life. This is just one of the case scenarios that I would like to try. Thank you.